Hello everyone! My name is Lablishino Mario and I am your student nurse for today. For today's demonstration, I will be performing the proper perineal and genital care for female patients. The purpose of this demonstration is to prevent infection, maintaining skin integrity, and of course promote patient comfort. The first one that I'm going to do is, of course, I'll be going to assess the client self-care ability. So I'm going to ask my client if she wants me to clean her genital and perineum area. Okay, but if she doesn't want to, of course, I'm going to let her to do it alone, but I'm going to instruct and of course provide guidelines, okay, on how she do it, okay?
I am washing my hands to remove all the bacteria, the microbes, the dirt, and of course, to prevent the spread of microorganisms. I already prepared all the materials that I am going to use in this procedure to avoid interruption.
Okay, so before we start, I'm going to identify the client first. Okay, may I see your wristband, ma'am? Okay, what is your name, ma'am?
Andre.
How old are you?
19.
Okay, so I'll be explaining the procedure that I'll be going to do to you. So basically, I'm going to do a perineal and of course genital care. So basically, I'm going to clean, okay, your perineal area. This is done to provide comfort, to prevent the infection and inflammation. Okay, is that okay with you, ma'am? All right. Okay, so the next one that I'm now going to do is I'll be now going to close the door, the window, the curtains to provide a privacy to my client. Okay, so the next one that I'm going to do, I'll be now going to put the waterproof pad on the buttocks of the client to prevent the water, okay, from dripping onto the linens, okay, or on her bed. Okay, so may I ask you, ma'am, to please flex your both of your knees. Okay, and then I'm just going to drape it. Okay, and then I'll be now going to insert it. Please lift your butt. Okay, thank you. So as you can see, the patient is now in a back lying position, and her legs is her knees are flexed, okay, and well separated apart, okay. So the next one that I'm going to do is I'll be now going to fold the top linen, okay, on the foot part, alright. Okay, once it's done, so the next one that I'm going to do is I'll be now going to cover the body of the client, okay, specifically her leg and her body, okay, with the blanket. So I'm just going to get the blanket, okay, and put it on her body. Okay, so the next one that I'm going to do is I'll be going to tuck the blanket onto the inner side of her legs, okay. All right. So the next one that I'm going to do is I'll be going to bring the middle part of the blanket, okay, up to the pubic area or pubic part, okay. All right. Once it's done, so the next one that I'm going to do is I'll be now going to get a bedpan, okay, and put it on the buttocks of the patient, okay. Please lift your, okay. All right. So once it's done, okay. So basically, I did that so that the water will drip, okay, onto the bedpan, okay. Before I proceed to clean the perineal part of the patient, I'm just going to put a gloves on. Okay, so this is to protect myself, okay, and also the client. this is a clean glove. So, okay, so now that I have my gloves, I'm now going to perform cleaning the perineal area of the patient, okay?
Okay, so I'm now going to clean the perineal area. First the meatus, down then labia minora and majora. So I'm going to use the figure of 7 strokes. So I'm going to use new cotton balls, okay, for the 7 strokes. Okay, so I'm going to hold the upper. Okay, so I will not release it until I'm not yet done. Okay, so I'm going to first clean the labia majora. Okay, 1, discard, 2, the middle part, and of course 3. Okay, and then I'm going to switch on to the other one. Okay, 1, 2, and then the last one, 3, and of course the last one, the middle part. Okay, and that's the 7 books on how to clean the perineal area.
Okay, so the next one that I'm going to do is I'll be now going to get a the cup with the water. Okay, so what I'm going to do is I'll be going to rinse the perineum part. Okay, and then once it's done, I'm now going to get a clean pod, a clean dry pod. So I'm going to dry it, especially the labia folds. Okay, alright, and then I'm going to discard it, okay, onto the hamper. Alright, okay, so once I'm done potting dry the perineal area of the patient, I'm now going to note for any signs of inflammation, swelling between the labia folds. I will also going to note for excessive secretion, orifices, and presence of odors. Okay? Okay, so the next one that I'm going to do is I'll be now going to turn the patient onto the onto the side, okay, facing the wall, so that I can clean her buttocks area. Okay? Okay, so I'm also going to get a cotton balls again, okay, and clean the buttocks part. Okay, alright, now that it's done, we're going to pot dry the buttocks of the patient. Alright, so I'm now going to put the one, okay, beside, and then I'm now going to reposition the patient. Okay, so the next one that I'm going to do is I'll be now going to dispose all of the linens that I've used. Okay, so this will go onto the hamper. Okay, dirty linens, and then okay, so I'll be now going to, of course, dispose all of the things that I've used, and of course the gloves, okay, onto the proper bin. Alright. Okay, so the last one that I'm going to do is I'll be now going to wash my hands to remove all the bacteria, to prevent the cross-contamination, and I'll be now going to document, okay, and note for the unusual findings. Okay, and that's the end of my demonstration. I hope you learned something. Thank you so much for watching and listening. Bye bye.